residency was incredibly challenging. I think this is when I really felt like I was becoming a doctor. So even though, I obviously had graduated with my degree from Turo, this is when you really learn how to be on your own.
Hello, everyone. Welcome to the latest edition of the Touro University California Alumni podcast called The Current. I'm Glenn Faison, the Alumni Engagement Director here on campus. Joining us today is Dr. Jessica Mitter-Pardo. She's a 2022 graduate of the College of Osteopathic Medicine's Doctor of Osteopathic Medicine program, so one of our DO alums. Recently completed your chief residency in family medicine at Montefiore Health System in the Bronx and are entering reproductive health fellowship through the Reproductive Health Access Project at the Institute for Family Health in New York City. Did I get all that correct?
Yes.
Oh, great. Well, welcome and thank you for joining us today and taking time out of your schedule. We really appreciate it.
Thank you so much. Yeah, I know all of this training could be a mouthful, but I'm very excited to be here.
Well, I want to touch briefly, let our viewers know a little bit about you. This whole science thing is not new to you, and this public health thing is not new to you. You got your bachelor's in public health and then your master's in behavioral and social health sciences, both from Brown University. You followed that up with a 2-year post-baccalaureate health careers program at Harvard University before coming here to Turo for the DO program. Is that correct?
Yes.
So, what brought you to Turo?
I know it's been quite a long journey, but what brought me to Turo was really I wanted to pursue a medical training, kind of as a continuation of my public health work. And so I was really looking for a place where I felt like public health was valued. And despite not needing to do the MPH joint program myself, since I had already done that training, the fact that that was offered and they had the infrastructure of a public health department was really valuable to me. And so I really wanted to go to a university where I felt like I could get that kind of involvement. And that's something I was able to still be involved with during my time in medical school. I actually served as a research assistant and was able to get a publication through as well with my work with Dr. Sahai Burrows. So it was really great to be able to go to a medical school where I was able to still kind of continue my public health work, which was really my roots and cause for getting into medicine in the first place.
So, you and your husband got married right before medical school. Do I have the timing of that correct?
I was actually right after my first year of medical school, and it was right before he started when he completed his master's. But yes.
Okay, Dr. Camila Pardo. Um, so, how did you guys meet?
Yeah, we actually met many, many years before. So Turo did not bring us together, but it helped keep us together, which was really great. We met back in college. I actually was very involved in a debate team when I was attending Brown and he was attending Boston University, and we debated each other in a tournament at Brandeis, and the rest is history.
Okay, do we want to go into the outcome of that debate?
Oh, well, you
I'm
could just
sure
say
I'm
I
sure it
won.
was healthy competition.
uh, you can say I won and I continue to win.
So what was it like going through medical school with your spouse? I mean, a lot of students. It's not unusual to have married students going through medical school, and they lean heavily on their spouse for to kind of help them and give them the support that they need. In this case, both of you were going through medical school. So what was that like?
I think it was challenging because we're both so busy, but in some ways, really helpful that we could really understand what we were both going through. We actually, since I started a year before my spouse did, we were not in the same class originally, which I think was actually good because we weren't going through the exact same stress at the same time. But then I could kind of impart any like wisdom I had gained from being a year ahead to him. And then when I ended up doing my primary care academic fellowship, um, the teaching fellowship, that allowed me to take an extra year to build those skills and then also allowed me to graduate in the same class so we could apply to residency together, which was great.
Well, that's great. I was going to lead into that next. How important was it to have an opportunity to match together, at least geographically, if not in the same institution? You both ended up at the same institution, though, correct?
We did, which was our first choice, which was wild. But yeah, we did end up at the same institution, just in like the children's hospital arm for him and the regular hospital for me.
And how important is that the opportunity to do a couples match?
Yeah, I think it's huge because as challenging as I thought medical school was, residency was just a whole other can of worms. And so at least geographically, it was really important for us to match together. Of course, we entertained all possible permutations. You're allowed 300 ranking permutations when you couples match, and you better believe we had 300 combinations that we listed just because, partially because of my neuroticisms, but of course we ranked, all of the options where we would be together. Um, at least geographically first, even if that, would cause a compromise a little bit on either end for programs. And it's a really difficult process, but I think it's very valuable if it can work out, just because having that, close support system is really necessary in residency for sure.
Okay. So you've talked a little bit about residency. So what was residency like for you?
Yeah, oh boy. Residency was, I'm still processing what that the past 3 years were, but residency was incredibly challenging. I think this is when I really felt like I was becoming a doctor. So even though, I obviously had graduated with my degree from Turo, this is when you really learn how to be on your own, develop your own clinical practice, and kind of deepen your passion and understanding of medicine. And it was incredibly challenging, doing residency in like an urban underserved area, but this was also a priority of mine. And I think that it was difficult, but I feel now prepared to go really anywhere. I feel like having built the skills to be in a low resource setting, I feel really equipped to handle all kinds of medical cases. I feel like I practice global health by being in New York City, often treating, recently arrived immigrants and people from all over the world. And so I think that those skills have been invaluable, and can be really translated to a lot of settings. And so I'm very grateful for the experience, even if it was kind of challenging at some times.
So I would imagine that those are the kinds of things that you would expect to learn during a residency program. But what did you learn during residency that you didn't expect that was like, oh, I wasn't looking for that to happen.
Yeah, I would say a couple of things. One was really, I think, like on a sadder note, and then I'll have a more uplifting note after. I think was really just the emotional toll that it takes on you, especially when you're working in a setting like this, of realizing just the feeling the brunt of a broken healthcare system, and trying to fight against that and get the best, care for your patients. And you absorb a lot of like emotional trauma from your patients and from what they experience. Um, and I mean, I knew about these things. I've studied public health. I've studied and taught about structural determinants of health and structural racism, and these are things that I'm passionate about. But like spending 3 years really in the clinical side facing it was really hard. Um, but just as I had done before, I feel like, when you're facing these experiences in residency, you can let that galvanize your efforts for advocacy. And I think that, I try to kind of channel that into my advocacy work as well. And I think the other surprising thing that I had in residency was really like the relationships I built with my co-residents and my faculty members. When you're going through kind of such harrowing experiences together, you really realize like what each other's going through, and can kind of deeply understand this experience in a way that not a lot of, my other friends and community members really could. And I felt so inspired by my co-residents and faculty members, and I feel like I've left residency with these lifelong bonds that I like felt I would have to some extent, but I was really truly surprised in how important they are to me, um, for sure.
Well, great. So you touched on kind of the preparation that you had here at Turo. So what area or areas of study do you think best prepared you for your residency?
Yeah, so I am in primary care, and so I think my primary care academic teaching fellowship was especially useful and helping me prepare for residency. Um, Honestly, because I was also a chief resident in residency. And so for me, I have had this interest in academic medicine for quite a while. And so not just like the clinical aspects and the rotations, but getting that extra like experience of getting to teach and work on research and getting to pursue like my own kind of educational goals, like expanding curriculum around structural competency and things like that. That helped prepare me in residency to kind of continue those efforts even further in residency as a resident and then also as a chief resident. And now I'm taking that with me even further into the rest of my career as I pursue my reproductive health fellowship through a program called the Reproductive Health um, Access Project that focuses on advocacy as well and teaching. And so I'm still keeping these same elements that I really built upon at Turo, of combining like the clinical, the teaching, and the advocacy. And I feel like the fact that I was able to get involved with all of that in medical school really helped build my foundation for where I am now in my career.
Well, that's great. Um, for those who are maybe looking at this and they haven't decided if they're going to medical school or not, it's a rigorous program. You've got your track shoes on. Those who are in the program now are well aware of the rigors of medical school, but it's not all the grind. Um, are you willing to share some of your most fond memories from your time here at Turo?
Oh, sure. Yes, I have. I know there's so many more study spaces now, I think, on campus. I'm going to have to go back and visit. But I spent countless days in the library studying with big groups and making these trips to VEC to get samosas and paneer tikka masala and stock up on all the food and come back and hunker down, practicing in the for practicals, like right there on the library tables, and everything. And so I think it was like so nice to kind of really all just be in one space going through a similar thing. It felt like a really good sense of community, even when we're all going through the same like stressful exam period at a time. But um, I found like those times to be really fun. Like, admittedly, we weren't always just studying. It got a little silly in the library and everything sometimes, but yeah, that was that. I fondly look back at those days um, and also just getting to explore like the beauties of Sonoma County with my like fellow medical students whenever we got a chance, like being able to like go on hikes and explore like all the natural beauty as a break from Mare Island when we when we needed
Oh
it.
yeah, I mean, Mare Island's a great central kind of a jumping off point for most of the nine Bay Area counties. So, depending on
Exactly.
what you enjoy, you can probably find it within a 45-minute drive. So yeah, yeah. So you completed medical school and into residency, basically during the pandemic. How has the pandemic and its immediate aftermath shaped your views on the future of medicine?
Boy, that's a big one. I think it's hard. It's really hard. I think the time of COVID revealed a lot about our healthcare system. It revealed that we are not really prepared adequately to deal with large scale kind of pandemic events that I think will become more and more um, common during with changes in climate and things like that that can leave us more susceptible to disease. I think it revealed, as we already know, especially in kind of like the public health world, that certain people and populations are more susceptible to worse outcomes from COVID than others due to issues with our society and our structures, due to structural racism and lack of access to um, not just healthcare, but food, education, and other things. And so I think it revealed a lot of areas of weakness, and unfortunately also kind of ushered in a time, I think, when there was a lot of misinformation and doubt in science and medicine. And so I think really it's laid the groundwork for a lot of things to need to be done, which is maybe it's kind of that the fields of medicine has really been shaken from all of this, and hopefully we can rebuild to be stronger because of the fact that it's kind of revealed so many areas that really need to be addressed. It's hard to kind of tell, where we go from here. I think we're in a difficult time in medicine as a whole because of that. But I hope that, at least in the public health and medical communities, that this has sparked a conversation around things that we've known about for a while. But I hope that it has galvanized, efforts to improve our healthcare systems and access. And or I don't know if it's my own perception, but I think that it has really gotten physicians and public health advocates and others to become a lot more outspoken in using their position to really speak out about, these different issues. So I think that's a really interesting turn, like in the field of medicine, where we're seeing a lot more like physician advocates and public health advocates. And I think that's a turn for good things to come in the future.
So you always hear that you got to take care of yourself. And what's the cliche? Physician, heal thyself. Something
Yeah,
along those lines. I know they stress it here at Turo during orientation. Make sure you take time for yourself. Make sure you keep up with at least some hobby that brings you joy, that you can squeeze in around your studies. Residency, again, it's a track shoes on situation. How do you decompress? I mean, setting the whole COVID situation aside, just
yeah.
becoming a doctor, becoming fully trained, completing residency, you had to develop strategies to keep sane. So yeah, how do you decompress?
For sure. For me, I think it's getting outside. Like I need a break from screens and a break from, the screens for studying or from doom schooling or what have you. I need a break. As the young people say these days, like touch grass. Like we need to like get grounded, get outside. So in my fourth year of medical school, actually, my husband and I got a little very cute doggy named Ledoux, a mini golden doodle. And so we take him out for walks. It is a great excuse to get outside and get away. And I'm lucky to live in New York City now, too, which is an awesome place to walk around. I live only a few blocks from Central Park. So love to get lost in Central Park with my dog and get some breaks outside. I love to bake also, which in medical school we had some churro baking, great churro baking show competitions,
Okay.
unofficially. So we love to bake as a nice kind of break as well. So just things that I can do that are like more with my hands or my body and give my mind a break.
Wonderful. So your specialty is family medicine, but you've kind of found your niche within family medicine. You're focusing on HIV and reproductive health now, right? Is that correct?
That is correct, yes.
Okay, so talk to us for a bit about, the process of finding your niche within a broader specialty like family medicine.
Yeah, I think that that is the beauty of primary care and family medicine, is that there are so many hats you can wear, and usually the like common problem among people, especially in family medicine, is that we love everything. We have too many interests. And it was definitely something that I struggled with in residency. I was like, I just love everything. But what brought me to family medicine was initially when I had entered medical school at Turo, I was interested in like OB versus like infectious disease because I had this public health background and interest in HIV from my HIV research. And I had an interest in reproductive health and obstetrics. And I was like, how can I do both of them? Like, I have to figure out a way. And I started to meet people that were Turo alums and others that were at different family medicine programs where I learned that they have all these different kinds of tracks. So even though it is such a broad kind of, specialty, a lot of programs offer tracks in different things like sports medicine, reproductive health, obstetrics, addiction medicine, etc. And so I was like, okay, there's a space actually to kind of not specialize, but get a little bit extra training in these specific areas. And then you don't have to choose between your interests, which is great because I had that common problem where I was in my rotations and I was like, I love every single rotation I'm doing, except for surgery, I won't lie. But so I think that was great when I kind of realized that that was a possibility during my rotations. And then I think though, like in other fields, like even in any other specialty, there's definitely niches that can be carved out. There's in emergency medicine, my husband Camilo is pursuing a pediatric emergency medicine fellowship, and he has his own kind of niche and focusing on like incorporating social determinants of health screeners and things like that. And so I think there's so many ways to have like a passion project or a passion field and tie it in into whatever specialty you're in, and just kind of figure out if like you can carve out like a niche for that that maybe you haven't seen modeled a lot for you before. And that's kind of what I'm trying to do now. With I completed tracks in both reproductive health and HIV at my residency, and now I am about to actually sit for the HIV certification exam, and then I'm doing this reproductive health fellowship. And so my goal is to provide primary care, but also with a special focus on kind of what I call is like a fully inclusive like sexual and reproductive health as well. But we'll see what that looks like maybe when I come back in 10 years on the podcast.
So you've agreed to be a mentor with the pilot alumni mentorship program that we've got going here on campus. It's gonna, now that the academic year has started, we're gonna start making matches. So thank you for making yourself available for that, and I thank you on behalf of either the student or the students that you're going to end up being paired with. What do you hope to accomplish by being a mentor to current medical students?
I think really just that I basically, was kind of just discussing. Like, I think it's nice to just see other models of, like slightly different career paths, different from what you might just be exposed to on your regular rotations, and just to be able to pursue like what those different interests are, whether it's advocacy or education or things like that, and seeing that, the career can be full of things that's not just clinical. And I am interested in kind of just helping students figure that out. Like, what is their passion and how can I help foster that? How can I help connect them? Just because I think it's something that like I would have loved to have like a specific mentor to help me with, but my interactions with different people who were alum did help me kind of reach this conclusion. And so if I could help someone, kind of get a little bit more clarity during the crazy time that is rotations when you're trying to figure out what to do with your life, then that would be great.
Okay, so what advice do you have for the current students who are still here on campus doing their didactic work?
Oh, yes. During didactic work, I would say it's really tough for sure. The grind, of getting through one block exam to the other, it's for sure tough. But I would say just keep in mind that this is not what you went to medical school for. It's going to get a lot better. I think, of course, like the didactic work is interesting and everything, but everybody's itching to get to actually be out there in the field. And that's what your whole rest of your life is going to be. So just thinking of it as like, this is a means to an end and you guys can do it.
And how about advice for those students who are just starting their rotations, either for the first year or coming back for their second year of rotations?
Oh, for sure. I think that in rotations time, honestly, the best advice I could give is to really try to put yourself in every rotation thinking like, this is day one of my residency in this field. Like, this is pretend that you are in that specialty. And I think that that will allow you to take full advantage of the rotations and also to really see if it's something that you like and could see yourself doing. And even if not, it at least will help you take away more, like learning wise. This is your only, maybe your only chance to learn anything surgery related, or your only chance to learn OB if you never pursue that again. And so I would take full advantage of it and just really try to put yourself in the shoes of, like as if you're a resident in that field, to take the full advantage of the experience that you can. I think that really helped me, maybe confused me a little bit, but helped me um, ultimately.
All right. Um, so, last series of questions here. September is Women in Medicine Month. So, talk to us about the ongoing need to bring more women into the practice of medicine.
Yes. Of course, there's definitely an ongoing need. I think it's getting better in terms of enrollment, but conditions could definitely improve. And I think we need to think about not just women, I think we need to think about representation along the gender spectrum and of racial identities as well, because I think ultimately what's going to better care for our patients is having providers that represent the intersection of identities that they have. But in terms of like specifically cis women, at least, I would think that it's going to get better when we start to improve conditions um, for women to be in medicine, and I think that is the big question: is how are we going to do that? Um, I think that we're only going to get. Oh, sorry. I think this is your question later.
No,
I'll.
go ahead.
I
Yeah,
can. I
yeah,
can. I can cut it off.
yeah. No, no, that's fine because you were because you're right. You were going right where I was going to try to take you. So, do you envision a time when we as a nation will actually achieve some level of parity? And originally, because September is Women in Medicine Month, that's why the question was structured the way it was. But the way you've been answering it thus far takes it from a more holistic and a broader brush, broader approach. So let's tackle it from that perspective. Do you think we'll ever get there? And if so, how?
Yeah, I think that parity would improve when we have improved systems for things like family leave, breastfeeding accommodations, or chest feeding accommodations. Because right now, people have to choose between their careers and parenthood. I mean, we're currently, right now, 25% of female doctors struggle with infertility, which is a rate that's twice of the general population. And it's posited that it's due to a variety of factors such as stress and also the lifestyle of being in a physician and in training, like during peak reproductive years, and a delay in conceiving because of that. And we have to think about how it's really affecting the health of, female doctors. And 40% of female doctors leave their careers or go part-time within like the first 6 years after leaving residency. And we have to ask why about that as well. These are women who were highly motivated, made the same sacrifices as everyone else to go to medical school and residency, and now they're having to take big pauses from their careers or leave entirely. And that's a really difficult position that we're putting women in. And women are also still paid less. Like even now in medicine, women are paid 74 cents on the dollar um, as men, and they're tasked with more unpaid labor. They're asked to plan kind of things that are thought to be like more female oriented, like planning wellness retreats and other things like that. So even in medicine, that bias still exists. And I think all of these things, these are just a couple of examples that I could think of, but all of these things are reasons why we might not reach parity, or even if we do reach parity, we're still not supporting women in their careers in medicine going forward. And I think those are all areas that we need desperate improvement.
Well, I think we're about at our time for the day. Again, Dr. Jessica Mitter-Pardo joining us from New York. Thank you very much for your time and for sharing your thoughts with us today. And to everyone out there who may be watching and listening, thank you very much. Until next time, Take care.
Thank you so much.